So, hi guys, this is just a talk on breaking barriers, diverse experiences in medicine. And we've got Dr. Omon and Dr. Ayede, but I think we're just waiting a bit on Dr. Omon, and they're just from the Organization of Black Women in Health. So you can take it over from here.
Okay. All right, thank you very much for having me. I'm really excited to discuss on diversity in healthcare. So I'm Dr. Ayede Ologun. I'm a GP in Manchester. I'm a life coach, and I'm the General Secretary for Black Women in Health Network in the UK. So I was born in the beautiful. I was born in the beautiful city of Benin, Nigeria. And can you see my screen and hear me? So I have to ask again because I can't see anyone.
Yeah, we can.
Okay. All right. So I was born in the beautiful city of Benin, Nigeria, and I went to medical school at an American medical school in the Caribbean, beautiful island of St. Kitts and Nevis. Yes, we could see the beach by my classroom. So, and I trained as a junior doctor at All and East Yorkshire Hospital in northeast of England, and I did my GP training in Blackpool, Northwest. So I wear several hats at the moment. I'm a salary GP here in Salford. I'm a board member for the Royal College of General Practitioners Northwest Faculty. I'm also part of the RCGP BIN network. And we are part of the tax advisory force that advise the college on representation and positive inclusion with regards to equality and diversity in primary care and in the Royal College of General Practitioners. I'm a clinical supervisor, I'm an out-of-hours supervisor, and an OSCE examiner for University of Liverpool and Manchester Medical Schools. I'm the General Secretary for Black Women in Health, which is a beautiful network that promotes inclusion and diversity. We promote empowering Black women who work in healthcare to aspire and attain maximum personal and professional development as a whole, so that they can contribute significantly wherever they are. I'm a certified life coach. I'm an affiliate for the Harvard Medical School and then also the International Associate of Coaching. I'm a speaker and also school governor, so just several hats I wear. So today I'll be discussing on diversity in healthcare, and I'll touch a little bit on what we mean by diversity, embracing and promoting diversity, the barriers that is encountered with regards to diversity in healthcare and how it applies to us as healthcare professionals and also aspiring medics, and breaking these barriers and building bridges. So what is diversity? I mean, throughout our years of training as a medical student in the Caribbean, which is a different country, a different culture, and then as a junior doctor in northeast of England, which is a different country and a different culture, I faced and encountered diversity in all kinds of shape. Diversity in my race, diversity in culture, my speech, the way I talk, perception, my gender, education. And what did I do when I faced all these forms of diversity? I ran away from embracing it. I always felt that I needed to fit in so I could be accepted. So I didn't think about using my voice. I didn't think about bringing in innovation and contributing my skill sets to the organization, NHS, where I was working. It did take me a while for me to, in the course of my career as a junior doctor and as a BIM doctor, to fully understand the benefits of living in a diverse society and also working within a diverse workforce like the NHS. Because we're all different, and it will be a dull world if we were all the same, to be honest. And I believe everyone occupies a space, and we have something different and unique to bring to the table. And that is what diversity really is. So diversity is just appreciating all these differences of people, treating their values, respecting it. And these differences can be along the dimensions of race, ethnicity, gender, sexual orientation, socioeconomic status, age, physical disabilities, religious beliefs, political beliefs. It can be any of this. And I will go further to describe a diverse individual. And this is describing myself and many people out there. Is recognizing that we are unique, embracing our differences, and contributing to innovation and skill sets in any healthcare organization. What are the barriers to promoting diversity? The barriers can be conscious and unconscious. Discrimination, whether it's conscious and unconscious, are unfortunately experienced by BAME and marginalized individuals. It can be microaggression in certain workplaces, within teams, and this can be a big barrier to promoting diversity and inclusion. Because I've heard statements like, oh, from doctors, and when we meet to discuss diversity in our task force, that people say, oh, I'm different, so they can't trust me, or they're not British trained doctors, or they're quite surprised you speak good English. And these are forms of conscious and unconscious bias that hinders diversity being promoted. And this is what we're trying to work against. There are organization structure and systems that stop lack of inclusion. I mean, we can't discuss diversity without discussing inclusion. Unfortunately, when there is no inclusion, there won't be representation of a diverse workforce. At top levels won't represent the people they do, a certain group of people within the workforce. Inclusion is not just being invited to the party, it's being allowed to dance, being allowed to have a drink, being allowed to sit at any table you want. And that is simply translating to giving opportunities to all healthcare professionals that is good and fair to all, I would say. So also, lack of awareness. There is a lot of lack of awareness, which is one of the barriers to promoting diversity within NHS and healthcare organization. People don't understand the principles of equality and diversity, or people that know about it and don't promote it. No one is speaking out, so the culture is just continuing. And also spectator mode. I use this to describe workers in healthcare who might be BAME workers or marginalized workers or people that they feel they are different. And this is when they tend to take the back seat in meetings, they don't put themselves forward in contributing. And this could be because maybe they've tried before and it didn't work and no one listened. And so they've moved to this spectator mode. And this does not promote diversity because we need people to step up to actually represent and to actually promote diversity. And in embracing diversity and promoting it, we all have a role to play. It's crucial to ensure that everyone is equally respected in the same way, and also promoting inclusivity, because this brings in skill sets and innovation to the table to help the NHS or any organization. And I realize working in the NHS is a fantastic opportunity for us to all bring in diverse experiences and promoting inclusivity. So everyone here, aspiring medics, this is one of the mindsets we promote when you're starting as a medic, or when you start as a junior doctor, or when you're going into specialty. Bring in the fact that you're bringing in something new, a skill set to actually contribute to the growth of the organization, not just working for a salary. Okay. When diversity is embraced, this improves or brings about productivity for any organization, better problem-solving skills, and also individual and organization growth. And this is what helps to build great leaders, job satisfaction. People don't call in sick often. People actually stay in jobs longer than leaving every 3 or 6 months, and also positive attitudes. So this is my best part of my presentation, is breaking barriers. How can we break barriers of diversity? Like I said, it's everyone's role to do it, to break barriers and to promote diversity. And the first thing is knowledge is power. Everyone being aware of the principles of equality and diversity is important to promote inclusivity. It's important to understand people's differences so that they can be included in everything, so that there can be equality across all levels. And that's where knowledge is power, awareness of this. And also being aware as an individual, diverse individual, about the Equality Act of 2010 and also the Woman Act of 1998, because these acts, they all talk about preventing discrimination based on race and several others that I've mentioned. Also, intentional efforts we're promoting for NHS to promote inclusivity, and NHS is doing a fantastic work, although there's still more work to be done, but they are promoting this. And it's not just the NHS, like I said, it's everyone's job. So anyone aspiring medics, you enter into the NHS, step forward for roles, put yourself forward for so many things that can actually promote diversity in your place of work or your training post, or even as a medical student. Also, I like talking about authenticity as a coach. Diverse individuals is about embracing one's authenticity. Because we are unique individuals and we all have something unique to bring to the table. Okay? And I always tell people that you have to be yourself because everyone else is taken, and the best person you can be is yourself because you can do that better than anyone. And I love talking about being one in 400 trillion because scientists did a research a long time ago and they found that the likelihood, the probability of someone looking exactly like you with your characteristics, your behavior, your ideas, your looks, the way you would do and execute certain tasks is actually 1 in 400 trillion. That is massive because it means everyone here attending this talk, everyone out there is unique. So I want us to think about this whenever we're working in any organization or if there are any healthcare professionals, organizations on this talk. I want us to think about this when we're actually employing people and when we're trying to promote inclusivity because we're all unique and we can't afford to waste talents by not including people and embracing diversity. Breaking barriers. With breaking barriers, the other stuff to learn for individuals, is how to fail forward, how to build resilience, because we will face diversity at some point in our lives. It could be across anything, whether gender, whether race, whether your ethnicity, disability. It's how to build resilience to keep going forward when you face diversity, the ability to always speak with clarity and conviction when you need to, and to always promote it wherever you go is why I say resilience in this aspect. And also calling out injustice. It is everyone's responsibility because if you see a colleague, a patient, a fellow student, or someone being treated unfairly due to their race, due to their sexual orientation, due to their gender, is that ability to actually call it out and speak out for those that don't have a voice, or even speak out for yourself if it happens. Because the truth is that if it happens and you let that culture go on, people are going to come and still face such a lack of diversity in that organization or that place of work. And if you remain neutral in situations of injustice, you're choosing the side of the oppressor. That's it. We can talk about, I say building bridges as the next step after breaking barriers. And the first thing I talk about is being an ally, forming allyships, being aware of ourselves. I'll talk about allyship in a moment, but being aware and educating ourselves, speaking out for those who can't, mentorship, and also building relationships. This is very important in building bridges. Relationships are very important. There are different types of currencies which anyone will earn when you become a healthcare professional. If you're an healthcare professional, you earn monetary currencies, you earn relationship currencies of performance. Performance currency is just because you do so much work, you do it well, you get bonuses. Monetary is just you do your 9 to 5, you go home, you get that. But relationship currency cuts across everything. It's very important. Is when you build good interactions with people, when you share understanding and understand everyone's differences, and this promotes diversity on all levels. So I always say the best way to build bridges is actually building relationships. And I like telling everyone that poverty is scarcity of relationship, but success is abundance of relationships. Ally. So NHS England has got a write-up on the website about Ally, but anyone can check the guide to allyship.com. And this is where we actually advise people to try and use their privilege to promote equality and diversity. Lend your privilege to others, speak out for others, and stand up for those who feel scared, those who can speak out for themselves, and don't allow any form of injustice if you're there. Just say no to any such thing, because this is the only way everyone can contribute to promoting diversity and inclusivity and equality. So in summary, I'll just quickly round up. Embracing diversity is important. It promotes inclusion and organization growth. Embrace your authenticity. Everyone is unique and has something to bring to the table. And always remember, when you have a group of people working for you, or when you're working in any group, you're authentic and you have something to bring to the table. Use your voice, lend your voice to others, be a vehicle of change, be an ally, build relationships, and never forget that you're 1 in 400 trillion. You have something to bring, and everyone around you is also 1 in 400 trillion. Everyone is unique. Thank you. Hello. Hello, can you hear?
Are we there? Yeah, so if we could hear from Omon now.
Hello everyone. Can you hear me?
Yeah.
Yes, good afternoon. I'm Dr. Omon Imohi, and I'm going to be talking about breaking barriers, persisting despite all odds. I'm going to tell a bit of my story, first of all. I was born and I grew up in Nigeria. Growing up as a young girl, I had a dream, and my dream was to see the world, and I also wanted to be a doctor. During the course of my journey, I failed my GCSE and I had to retake my chemistry. During that time of retaking my chemistry, when I failed my GCSE, I really felt very low, felt very bad. But my dad told me a few things. And one of the things he told me that echoed throughout my career is that you are not a failure. It's okay to fail. It's part of the process. And this will take you through your career if you can understand that first bit. He bought me 2 books, Tough Times Never Last, But Tough People Do by Robert Squella and Gifted Hands by Ben Carson. These books really helped me. They changed my life. Reading that book by Ben Carson, understanding a young Black boy going through the educational system, going through being, below average to becoming one of the best students in school, going through becoming a doctor during the time of prejudice in America and succeeding to become the youngest pediatric neurosurgeon at the hospital where he worked. That really got me going. That made me realize that I could be a small girl from a small town in Africa, but I could achieve anything I put my mind to. And that was where my journey started. That journey took me to Windsor University School of Medicine in St. Kitts, where I gained my first degree. And then I came to the UK, I took my PLAB exams, and I got into foundation training and proceeded to my GP training in Mersey faculty, Merseyside, UK. I'd never been here before. When I came in, it was a shock for me. The cultural shock, the slangs, the lingo, learning to integrate into the system, everything was a shock, but I had to learn. They say change is the most constant thing in life. It was not always easy peasy. I know you can see my journey so far on the screen, but it was not always that easy. There were times when I felt like giving up. There were times when I felt out of place. There were times when I felt, why me? Why will people treat me this way? Why will people look down at me just because I'm a Black doctor? Why will people not want to associate with me? Why will patients sometimes say they don't want to see me? But I learned along the journey that was part of the process. And I grew in my career only because I learned that I could break those barriers and I could build bridges with them. I could pick up the stones that people, literally threw at me, and I used it to build my career. And it was all about persistence and a few things I'll be talking about down the line. But just to tell you, from that little girl that grew up in Nigeria, went to medical school in the Caribbean, came to the UK with, shock integrating into the culture. I've grown in my career. I became a GP. I fully qualified as a GP in 2015. I'm a member of the Royal College of General Practitioners. I'm a diplomate of the Faculty of Sexual and Reproductive Health. I was recently nationally elected as a council member of the Royal College of GP. I am the founder of Black Women in Health, which you've heard Dr. Ologun talked about already. It's a group that I created when I found out the barriers I had to go through. I created this group because I wanted women of Black and ethnic minority group to feel support, to feel connected, to feel engaged, and to empower and also celebrate ourselves. And I'm also a GP community tutor. I'm so passionate about teaching medical students and letting them know that they are limitless and they can be anything they want to be. I've won a few awards. My audit awards were published in the NICE Shared Guidelines this year. I was awarded GP of the Year 2019 by the RCGP Northwest Faculty. I'm a keynote speaker, and I recently published my book, 7 Hours of Greatness. So what is diverse experiences? Most of the great things in the world has been accomplished by people who have kept on trying where there seemed to be no hope. As a BAME doctor, the experience in medicine and healthcare is totally different. There are times when you will be disregarded. There are times when, you know, people might not really want to listen to you. The first time you speak and they hear an ethnic accent, they might just feel, what does she have to say? But what I'm here to tell you today is that you are no different from anyone else that's in the same profession. It doesn't matter where you've come from, whether you've come from Africa, even if you are from the UK, but you've grown up in a council estate, or you're from a family where no one else has been to university, no one else has studied medicine. You were the first to toe that line. I'm here to tell you today that if it's been done before, you can also do it. And, you know, even if it's not been done before, you can be the first. There's no law that says you can't. Okay? Why blend in when you can stand out? I always tell people this: why blend in when you can stand out? Like Dr. Ologun has already told us, you are 1 in 4 trillion. You are unique. You are made for greatness. You are made to be here for a reason. As a GP in my career, day to day, I have to face my patients. I have to deal with their needs. We get to see a variety of cases as a GP. So you get to start your clinic. You can have a UTI and, come in. The next thing, you have someone with chest problems, someone with kidney problems, someone who just wants to speak to a GP because, the stress of life is coming on them and they've got mental health issues. It's a variety of things you see in GP. In GP, sometimes you might actually have patients that come in because, they are having issues with, being homeless, or even issues with not being able to feed. It's a very diverse specialty where you see different things. But again, as a healthcare professional, being in that specialty, being a woman, being Black, again, brings its own challenges. But one thing I've learned, which I'll tell everyone, because I don't think it matters your color or, your gender, your sexual orientation, your religion, or where you come from. Be the best doctor you can be. Be the best medical student you can be. Be the best healthcare professional you can be. Do no harm. When you're anywhere you find yourself, create impact, do something different, do something that will make you stand out. For me, what makes me stand out in my job and what helped me through my career to grow to this level is being the best version of me. I go to work and I put my best face on for my patient, no matter what the day brings. I know, yes, there will be days when it's really tasking, when it's, when it's negative. You might have difficult patients, you might have difficult colleagues, but I go into work every day with my best self. And I go with the intention to give my best to my patient, to make sure that even if they don't like me, they leave there liking me because I try to be my best. And that's what I'll encourage you to be your best self. Because Vince Lombardi said that the difference between a successful people and others is not a lack of strength, it's not a lack of knowledge, but it's a lack of will. So you need to go in with the will. If you're an aspiring medic, I'm not here to tell you that it's an easy journey. It's not going to be easy peasy. It's not sunshine and rainbows. There will be tough times in medical school. There will be tough times during the career. There will be tough times during your training, during, progressing through life generally. There will be tough times. Life will knock you down. There might be times when you will fail exams. There might be times when your appraiser will not be happy with your progress. There might be times when the stress will become too much. But it's very important that you need to understand that you need to keep the will going. You need to persist through it all. Through it all, you need to persevere. And the most important question I'm here to ask you today is, what is your why? Why are you a medical student? Why do you want to study medicine? Why do you want to go into medicine? Why do you want to be a doctor? Why do you want to be a GP? Why do you want to be a surgeon? Why do you want to be a hospital doctor? What is your why? Because if you don't know your why, when you start to experience the diverse experiences or the challenges and the barriers we face as medical doctors, as Black people, as BAME people, as anyone you are, there are going to be different challenges for different people. When you start to face those challenges, if you don't know your why, if you don't know your reason for being there, you will break. You will break. You will give up. But once you know your why and you put that in front of you, it keeps you going. It makes you resilient. It makes you persevere through the tough times. It makes you persevere through whatever comes your way, either from colleagues, from patients, from the healthcare organization as a whole. You will persevere once you know your why, once you understand why you are in this career. And it's so important that you understand why you're in this career. I'm going to give a quick story about Beethoven. Beethoven, as we know, was arguably one of the most defining figure in the history of Western music. I know you'll say, Omon, what has this got to do with medicine? Beethoven went completely deaf at the height of his career, which means, it was around late 30s to 40. He had been playing music, composing music. He was a pianist and he was doing this all his life. But suddenly he went completely deaf. But guess what? Nobody knew. Nobody knew Beethoven was deaf for a long time. Listen to the Symphony of Truth. That's one of his greatest masterpieces. Beethoven composed and played that during the time of deafness, and many others. And people didn't know because Beethoven, kept going. He kept composing. And when they asked his servants later on, when people found out, how did Beethoven do it? How was he able to continue to create such masterpiece? And they told people that, Beethoven would put his head on the piano and he would play and he would feel the vibrations and the sounds of the music. And this kept him going. He was able to do this because he already knew the structure and how music was composed. So all he had to do was use that knowledge. Why am I telling you this? Beethoven knew his why. I think his why were three things. Number one, legacy. He wanted to leave a legacy of the greatest, of the best, because that was him. He wanted to be his best version, regardless of the odds. The second thing is obviously he needed to make money to feed his family. So he needed to continue. And thirdly, Beethoven didn't want to give up. He had a resilient spirit within him. So I'm here to tell us today that each and every one of us in our own life, we are composers. You're a maestro, you're a conductor, you're structuring and arranging the music of your life. I'm not talking literally about music. I'm talking about in medicine, in your career life, in your personal lives, in your relationships, in your community. You can make a difference. And it starts by listening to the voice within to compose your music, because the greatest discovery, you first of all have to discover yourself. You need to know who you are, what your identity is, what your purpose is, before you can even start to think about how you can make a change. Because authenticity is the greatest principle that will take you to your destination. And it starts by being the best version of you. I'm going to leave us with some principles that has worked for me. And I think that this will work for you, regardless of the specialty you go to. Number one is you need to have a vision. If you're an aspiring medic, if you are already in the profession, what is your vision? Where do you see yourself in 5 years? Where do you see yourself in 10 years? Because if you don't plan, you will fail. You need to have a goal. And please dream big. Don't be scared to dream. Dream as big as you want to dream, because it's free. It's the hustle you have to pay for. So dream big. In the career, you have to go with the mindset of the unstoppable. You have to have a champion mindset. You have to have a mindset that puts you there and you're ready to face whatever comes your way. A mindset of someone who's ready to be the best at what they do, because our mind controls everything. Every success in our life starts from the mind. The mind controls everything, because your thoughts become your words, because the thoughts you internalize become the words you verbalize. Those words you verbalize becomes the action that you portray. Your action becomes your habit. Your habit becomes your result, which produce the outcome you want in your life. So that's why you need to start from the mind, and you need to discipline yourself through this journey. Whether you're a medical student, whether you're already in the profession, is a continued learning process. You have to keep learning. You can never stop learning. You have to keep updating your knowledge, attending conferences, seminars, things like this to update your knowledge and learn more about the profession and how you can be your best self. And you have to keep a spirit of excellence. You have to be good at what you do, regardless of who's watching you, regardless of whether you're being appraised or you're being, supervised. Be your best at all times. Because when you are your best, the best comes out. When you are your best, you are more productive. Your patients are safer. Your patients are happier. And you yourself, you are contented with the profession when you have a spirit of excellence. And most importantly, persevere. Medical school will be tough for those that are not yet there. For those that are already there, you know how it is. There will be tough times, and there will be times when it looks easy, and it's not easy. It's just that you've worked really hard, and that's made it easy. But even though you are in the career, you're going from one specialty to the other, one stage to the other, you need persistence. They say persistence is what makes the water cut through the rock. Perseverance is the key to victory. Nothing in this world can take the place of persistence. Talent will not. Nothing is more common than unsuccessful men with talent. So even if you've got the talent, you need to put in the hard work. Genius would not. Unrewarded genius is almost a proverb. Education will not. The world is full of educated derelicts. So persistence, determination alone are omnipotent. One thing I've learned is that persistence, determination, and hard work are the greatest equalizer. It doesn't matter where you've come from. It doesn't matter who your parents were. It doesn't matter where you grew up. It doesn't matter the color of your skin. If you persevere, if you are determined and you work hard towards your goal, you will get there. Your superpower is basically your talent plus perseverance and action, and add in a bit of hard work, and you will get there. You will get there. So listen, I'm here today to tell you, not to bore you with what GP is, but obviously in any specialty you go to, be your best. Be the best doctor. Do no harm. And make sure that you give your best everywhere you find yourself. You can make an impact regardless of who you are. You don't have to be at the top. You can make an impact from the middle. And don't look at the money. If you're going into medicine because of the money or the prestigious, career, scrap that. You need to have the mindset of creating value, the mindset of being the solution to the problem. I'm here to tell you with pride today to be your best self. Break those barriers. There will be glass ceilings. There might even be, metal ceilings or metal walls. Break them down because you can. Every time that life knocks you, you knock back. And one day it will shatter for you. Unleash yourself to the world. You are unique. You are one of a kind, and you were made for greatness. I speak for the whole world. I speak for the NHS when I say we deeply crave to connect with you. Your music, your intelligence, your originality, your authenticity, the original you. Please come to GP. We need a lot of GPs. And be in alignment with yourself. Stay yourself. Be yourself. Express yourself. Be fearless in the pursuit of your success because you are limitless. My name is Omon Imohi, and I'm trying to change the stereotype. Thank you.
Thank you so much to our brilliant speakers there. Not only were the talks very insightful, but as someone in the chat said, this is the pep talk that we all needed. Very inspiring. We've got time now for 10 minutes of questions. If people would like to ask questions in the chat, I can direct them to our speakers. Yes, I feel like that was quite a good mic drop moment as well. Well, we've got a question here. How would you advise our students? What would you advise what process would you advise they take to help with finding their why, as you mentioned in your talk?
Thank you for that question. I think it's a very important question. To find your why, some of us, our purpose and our why is already in front of us. We just can't see it. Some of us can see it, but we are not living it yet. So I want to ask you, you can take a journal or take a piece of paper, write down, why do I want to be a medical doctor, or why do I want to go into this profession? Write out a few reasons why, and look at those reasons. And I think it will be good to classify them according to how important it is for you. Is it to save lives? Is it to just have that name, doctor? Or is it to make a difference in the world, in the community? Or is it just to make money? And I think you need to start to think about that, but something more importantly, think about what drives you. What motivates you? What inspires you? Who are those people you look at, not necessarily people that motivate and inspire you to want to be better and do more? What are the things about medicine that makes you want to go into it? What pumps you up when you think about medicine? Some people are so pumped up when they think about surgery and, doing surgical procedures. What motivates you? What pumps you up? What keeps you up late at night? What's that thing you're always researching about and trying to know more about? Because when you understand those things, it starts to explain to you what your why is. And it is very important to know that, even if you're thinking of legacy as your why, legacy is not about a building or, a street named after you. Legacy is the impact you leave in the lives of other people. For some of us, it's about making a difference for medical students, teaching, mentoring, discovering something, discovering the first vaccine for something. So think about what pushes you, what pumps you, what's that thing you like doing that even time stops when you're doing it. Even if they told you to do it for free, you will do it for free. Think about it. Mine is speaking. So I enjoy being a GP because I talk a lot.
Just something to add to what she said. Many people get stuck in their why, like, why should I do what I want to do? And I always say we find our purpose in service. So if you can't find what you're passionate about, you have to start while you're waiting, do what waiters do, serve. Start actually contributing, start doing things around, and you would find your purpose and your why very easily, because we find our purpose in service. So wherever you are, put yourself forward for things in terms of wanting to help, in terms of wanting to be a solution, in terms of wanting to contribute, and you always find your why in that aspect.
Yeah, but definitely sounds there like exploration is very important in that process. Even if you're not sure, still go forward with it and just see what you think. I've got another question here. Can we hear a bit more about Black women in health?
Okay, so Black Women in Health was it was a group I created when I was after becoming a GP. So basically, during my training years, I really used to struggle with a lot. I told you a bit about my story of the cultural shock and going through the training process. In the career, you need to have like support system. You need to have people you can bounce, your ideas on, or you can rant to sometimes, or you can just share your pain or the obstacles you're facing. So I had a group of friends. We were 4 of us in the group. We used to like share our pain, share our celebrations. When we moved to the next rotation, we would discuss about it and share. If someone had been in that rotation already, just tell us, give us some tips and all that. So I think it was really good to have that group. And I thought, why not make it a bigger group where we can have more people getting this type of connection, engagement, support, and also empowering ourselves. And that was how Black Women in Health was born. So Black Women in Health is a non-profit organization based in the UK for women of African and Caribbean origin, where we educate each other, we connect with each other, we empower ourselves, we celebrate ourselves. We have lots of events, webinars. We have over 400 members at the moment. So yeah, it's really a big community where, we just try to lift ourselves up and just be our best selves. Yeah.
We've got one more here. A student saying that they really want to volunteer at the moment because they enjoy it, but they haven't been able to find anything because of the situation with COVID. Do you have any suggestions of things they could look into when exploring these things?
I think volunteering, it depends on what kind of volunteering you want to do, but there are many ways to volunteer and there are many places you can approach. You can approach care homes, you can approach GP surgeries, you can approach retail services. It depends. If you're thinking more of healthcare, then I'll suggest that maybe befriending services as well in the hospital, in the care homes, and you can also approach the charities that do things like body system befriending, because sometimes especially during this pandemic, there are a lot of elderly patients that don't have families that can go to see them, and they might just need someone to help them do their shopping, or just come to talk to them. Some people just need someone. There's a lot of isolation going on right now, so that might be something that you might be able to find. And mainly, care homes are not accepting applications due to corona. A lot of places will not be accepting at this time because of the coronavirus, but you can find out things online as well that you can do, like webinars and events where they're doing health promotion and creating awareness. Yeah.
I mean, although many places are not accepting, like she said, you have to go to the your area. Like in Northwest here, we've got Spirits of Soul for the people that help elderly, and they do take volunteers. So you need to look for the local services in your community through the council. You can check your council website, and that way you can actually start doing some volunteer work. Or you might have to wait if you really want to go to specific places, like after the pandemic.
Thanks. I hope that will be of help to some of our students here. I've had another question. Any groups that you're aware of, like Black Women in Health for other ethnic minorities?
Yeah. Yes. There's a lot of groups available. There's the BAPIO, which is the British Association of Physicians of Indian Origin. There are Pakistani groups. There are Muslim groups. There's a Cameroonian group. There's a Zimbabwe group. There are lots of groups. There's a Nigerian GP UK's, Nigerian Doctors UK. There are lots of groups. I can share the list of groups with the organizers later, and they can send this out to anyone interested.
It definitely sounds like there's a lot out there for students.
There is, yeah.
Had a question. What about volunteering with charities? I'm not sure in what context that's in, but
I think you'll have to contact the charities directly, and there are a lot of charities out there that you can volunteer with. And as well, you can also think of things you can do, even if if you're finding it difficult to volunteer and you're really wanting to do something during this time. We are living in a technical world right now where everything is global, everything is just at the press of a button. You can start your own YouTube channel. You can start something where you can start sharing messages of inspiration or sharing health awareness messages. It's just about being creative in these times. You can also look around and maybe start, I don't know, there are a lot of things you can do really to make a difference right now. But contact the charities through their website, not going locally to the shops at this time. Go to their website and do something. Let me give you an example of what Black Women in Health did recently during the summer, because there was a lockdown and we really wanted to support Sickle Cell UK, and it was the Sickle Cell Week actually coming up. So what we did was that we created a virtual event. It was a virtual charity race. So basically, we asked everyone to donate, and we did a charity race. Everyone did it at their own time. We had a Zoom thing where everyone, logged onto Zoom, and we saw them doing their exercise, taking their walks, riding their bicycles, and people donated. We raised over 1,200 for sickle cell, and we gave that money to them. So that was a way of us supporting. Mm-hmm. So that's something you can do. You can organize a virtual fundraising event as well. So there are many ways. It's just to think outside the box.
Yeah, I would agree with that.
Just to add to that, because I saw someone wrote there that look close to you is very important, because during the pandemic in April, a friend, a colleague, someone died on the street, and she and her teenage son went and got numbers of everyone and from the WhatsApp group just to be checking. So you can actually just start something small in your community, get everyone's number, just a message, how are you doing? That is contributing.
Yeah.
You can do that.
Yeah, there's lots of ideas out there, I guess, and it's just about looking for these opportunities. I think we'll take this as our last question. What inspired you to make a change?
For me, do you want to go first, or?
What inspired me to make a change? I realized, based on the topic, because diversity is very close to my heart, I realized the importance of embracing that I'm diverse and what I can bring to the table. And I am a promoter of building relationships. So due to my experiences of being in a different culture, meeting different people, is what made me do what I do. Going into being a GP I wanted to be a neurologist when I started. but I didn't like hospital medicine. We didn't get to talk to our patients as much. And I felt, oh, GP, I'm going to talk to my patients as much as I want. Although we don't still get to do that because of the time restriction. But it's given me the opportunity to build relationships for continuity of care, which is why I do what I like to do. I'm also a coach because that is also an extension of me talking and building relationships and helping people. And I always encourage people to embrace their authenticity, embrace being diverse, and be a form of contribution, because someone made that space you're occupying right now. And the best thing you can leave is a legacy to make space for even more people, for the next generation coming, by what you do. So find your purpose and service.
Thank you. So for me, I think for me, what I would say, I was passionate about making changes in different ways. Professionally, I wanted to make a change in the life of my patients. Everywhere I go to work, I always look for something that needs to be improved. I'm passionate because I think that, our patients need us. We are here to serve them. We're here for that purpose. And once you have it in your mind that you're there to serve and that you are there to create value and be the solution to a problem, I think that alone will make you want to do something for the patients. It will make you want to make a difference where you go to. And at the end of the day, happier patient is a healthier community, and it really helps everyone, including the NHS, save money, and it helps us as clinicians as well to have to deal with less complications if we deal with the problem before it goes really bad. So I think that was the thing from the patient point of view. From the point of view of medical students and junior colleagues and, Black women in health, I wanted to make a change because I saw all the things I went through, and I don't want anyone to have to go through those things. I think representation really matters. And when I'm talking of representation, I don't just mean by being Black. I think even white young girls, white young boys, they can look up to us and see that they too can do this. They too can become anything they want to be if they put their mind to it. So I'm so passionate about being a role model and being the kind of person that people can look at and understand that regardless of their situation, regardless of anything, they too can be there. And I'm also a transformational coach. I'm so passionate about people being their authentic best self. My dream is for a world where people can achieve holistic abundance. And I think, it's achievable. It's just about us finding the greatness within us and bringing it out and being our best self. And I'll leave us with this quote by, Martin Luther King Jr. It says that he said that, not everyone can be famous, but everyone can be great. And greatness can be achieved by service. So always think of service. Everything else will come with that.
Absolutely, and that was actually quite a brilliant quote to finish with. I quite useful to think about there, and I'm sure everyone listening will as well. So thank you very much for speaking today. Thank you to everyone who's watched and asked questions. We're going to take a short break, and we'll be back at 2:30 with a talk about a career in psychiatry with Dr. David Codley. So thank you very much again. Enjoy the rest of the afternoon.
Thank you for having us. Thank you. Thank you everyone for coming.